to answer questions about the Bucksbaum Institute or to hear comments about it. I love today's presentations. Laura, I thought your presentation started us off beautifully, but each of these was a presentation that had been supported by the Bucksbaum Institute at some point along the way, and I want to thank all of the presenters very much. Laura, why don't you?
I just have a few comments. Thank you all for being here and sharing in this community that's surrounding the Bucksbaum Institute. I think each of the presentations showed people with passion and calling and creativity and disruptive thinking, and that's the kind of thing that I think is exciting and makes us remember why we went into medicine, why we feel joy in the work that we do. It does involve some skepticism, testing some assumptions. In your case, maybe stepping out of the usual clinical focus to have a broadened focus. With graphic novels in the inpatient unit, what a fabulous juxtaposition of two different kinds of work that together might make a tremendous difference for our patients. I think that the wonderful work that you're doing around patient or physician well-being is fantastic. And the projects that you present, Matt, I mean, everyone did a wonderful job. A couple of comments are, I think we need to share this work. Your passport example at the same institution where someone's working on a graphic novel or graphic approach to patient education in the ICU, there may be others who are doing such innovative work. And so bringing everyone together to compare their experiences and then writing about it, maybe exporting these ideas to other institutions, I think would be really great. Because our goal is really to help empower physicians, medical students, residents, and our patients to think a little bit differently about their experiences. Second comment is just about this idea of how when we're in a hospital, how can we not have access to care? I thought was such an interesting point. We all feel, there's a wonderful poet who talked about thirst next to the fountain. I'll say it again, thirst next to the fountain. And it's so true. We're surrounded every day by wonderful, incredible people, incredible resources, and yet have the irony that there are barriers in terms of our own accessing it. So I think the first thing is to be appreciative and mindful of it, and then every day try to do things on an individual basis, but then on an institutional basis to overcome those barriers. So sharing what wonderful work that you're doing, hugging the work for its passion and its protective factors, and then recognizing the limitations in our environment and trying to overcome them. Thank you.
Well, you did give a great talk, so it was a pleasure to hear you. And I thought the talks this afternoon were really, really excellent. So I want to congratulate. I don't want to pick any particular one out because each of them was interesting and thoughtful and really brought new data and ideas. So I was very impressed. A couple of thoughts which may be redundant. You may have done all this already. One of the things that is now a focus, which you are showing, but like Laura said, we need to start publishing these things and making them more available, is implementation of medical care. It's not viewed by some people as real research, but it is real research because medical care has been pretty static for decades, and now we're starting to think how to make it better and what are the things, and many of you pointed that out. And, we need to find places to publish it. There are journals that will accept this, where people can evaluate what we do and then respond and so on. The other thing in a university like this, I would really encourage you to look at people in sociology, behavioral economics, behavioral science, because we don't really have that kind of training. And I do think many of these studies could be enhanced by having input from people very experienced in research in these other disciplines that do have impact on medicine, but from a different vantage point. So I'd encourage you to think about that. Some of you may be doing that, of course, and that's important. In terms of the hospital experience, I think the data is that the biggest impact is from nurses, and that struck me that maybe a team approach to some of these studies is being done a little less than you might, but maybe you're not. I mean, maybe you are doing that, but involving the nursing profession and hierarchy in thinking, planning, and doing these studies in terms of team-based care would seem to me to be really important. So these are just some observations. Basically, I think really you're doing a great job, and I really compliment you on that. Do you have any questions for us? We're very benign.
Holly?
You always corrected me, so what's new? I think that's right. No. Yeah. I agree. I hope. Um, it seems an impossibility, but actually certain things turn out to be impossibly possible. I mean, I think if the top 10 schools, I mean, you chair a consortium of 13 schools, right? If we refuse to give them the data 1 year, that would do it, right? But none of us have the guts to do that, right? So we say, well, if you do it first and you don't do it, we'll do it second. But I think that would be a huge step forward because they make a lot of money out of fake stuff. And it doesn't do anyone any good. Honestly, these rankings drive people crazy. I got to tell you that when I go around the country, and forgive me kind of like an old person talking about it, everybody wants to be in the top 20. The 120 schools that are not there, if you go and ask them, what is your goal? I want to be in the top 20. They may be number 60. It's impossible. The change would have to be like an earthquake. But they still mouth this thing, and every year that they're not there, they feel they've lost. It's really bad, and this group that makes a lot of money and, does it on our data that we provide them, creates this. So we only have ourselves to blame, but it's tougher than, I wish we knew how to do that. I think it could make a very big difference because, despite what you say of the MCATs, every time that there is a point something difference in the rankings, people say, well, if you're 35 and you may have a 38 or 30, the 35 is still a problem, But it's just one of the things. There's the resident, all the other metrics. Is really hard, So I don't have an easy answer, but I wish we did.
I like your point, though, about challenging conventional wisdom. I mean,
Do
really
you?
challenging. Yeah, I think it's a wonderful point. And just to give an example, I mean, when I was applying to medical school, if you took a gap year, it showed you were uncommitted.
Yeah.
Now, oftentimes students are taking a gap year to enrich their experience, to bring that life experience to medicine. So that wasn't that long ago, really. Things do change. And I think it's
I think that's
because
right.
we step forward and say, no, we do want holistic review. We do want more well-rounded students with different backgrounds. So things do change. So challenging conventional wisdom, I think, is great.
And Holly, you can help me if this is right. I think the data is if you do well on GPAs, you do well on step 1, step 2, everything, those are correlated some, but none of it is correlated with being a good empathic physician. I mean, they just disconnected to that. So those intellectual things that do trend, but just because somebody's really good at whatever, data collection, memory, doing things, doesn't mean that they're going to be good with patients. Is that right? Yeah.
Right, yeah.
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 So it tells you something, right?
I'm going to turn the podium over to Holly. I want to again thank everybody for coming and participating. The speakers were wonderful. The questions were fabulous. And we look forward to our 7th annual Bucksbaum meeting, which will be next April. I want to thank Mrs. Bucksbaum especially for establishing the Bucksbaum Institute and for continuing to encourage us and to support us as we go forward. Kay, thank you. Arthur.
You know, Geordie left and he's chair of our board, but I did want to say on behalf of us, the board, you know, to Mrs. Bucksbaum that this is a remarkable program. I mean, this afternoon, this morning, the publications coming out, the impact on the institution. We've talked about it in generality, but I think to wrap up and say again the huge impact that your very, very creative ideas had on a whole institution. And now, as we talk today about making it more national, international, is really something you can feel very proud of. So I do want to congratulate you. It's 6 years in, it's a remarkable success.
Thank you for those good words. Believe me, 6 years ago, or however, it was a glimmer in our eyes more than 6 years ago. We never envisioned the widespread effect and the effect on this institution, as at least it's interpreted to me through this group. We never anticipated it, and we are really grateful for what it does, and I am very thankful for today's insight into that.